Hello, I'm Sheila Payne, and I'm doing this presentation on behalf of the European Association for Palliative Care on the RESPACC project. How to do a literature review. We start by thinking about the learning objectives, identifying what a review is and why it's important, understanding the basic requirements of conducting a review, develop an understanding of which review methods to use for different research questions, recognise key databases, which will be covered in Lecture 2, understand how to create a search strategy, also in Lecture 2, how to access papers, also in Lecture 2, understand the importance of synthesising data from literature reviews and critically appraising different synthesis methods. So, why should we do a literature review? The simple answer is that there are so many papers published currently and much too little time for everybody to sit down and read every paper that they're interested in. Even if you're a very good and fast reader, that's virtually impossible now. So what is a literature review? A literature review is a type of research method that presents an analysis and synthesis of work that's been undertaken in a particular area. The review involves identifying a question, or sometimes more than one question, which is then answered by a comprehensive and systematic identification of the available published material or unpublished material, an analysis of the material, and a synthesis, so a drawing together of a relevant body of information. And this is mostly research information, but it can include other things like policy documents, depending on the area that you're interested in. So the aim of a literature review is to identify what we know and what we don't know about a review topic. A literature review involves typically a desk-based method of appraising and describing an existing body of knowledge, a body of evidence. From this, we can draw conclusions on what is already published or what is unpublished material, and these are called secondary sources. So the aim of a literature review is to place future research in context, identify what's been undertaken is known or not known, and to inform clinical practice and further scholarship in an area. So there is a difference between a literature review and a systematic literature review, and this table helps you to understand some of those differences. So things like the question can be broad or can be quite focused. The sources that you search for can be not specified or are very comprehensive in the kind of search that you do. How you select things, how you appraise them, and the kind of synthesis that you undertake, whether it's a qualitative or a narrative summary, or whether you use some sort of quantitative method, like a meta-analysis. And it's also helpful to think about the inferences, the meanings that we can attribute to different types of reviews. So these are some examples for you to think about. So a literature review, as this one is here, published in Palliative Medicine, may be about the education, implementation and policy barriers to greater integration of palliative care, or a systematic review in this example is the clinical aspects of palliative sedation as reported in prospective studies. And it's the methods that are used that will define whether it's a literature review or a systematic review. It's not that one is better somehow than the other. They're just use slightly different methods. So the basic requirements of conducting a review is that you must have a review question, and you need to spend time thinking about that. And how to find a good research question has already been covered in this course. Methods for conducting the review need to be summarised in what's called a review protocol. So that lists the methods and the processes that you will use to conduct your review. And you also need to have methods to synthesize and interpret the findings. And we're going to talk a little bit more about that soon. So there are different types of literature review, as I've already explained. And this table is not completely comprehensive, but hopefully it'll help you start to understand the different methods. So a systematic review with a meta-analysis you might do if you have a lot of quantitative data that you can compare across studies. A systematic review with meta-aggregation you might use if you have a lot of qualitative research evidence and you pull those results together. Systematic review with interpretation can take a number of different ways of doing it, but the idea then is that you use qualitative research which you combine, but you reinterpret what those findings mean. You can, of course, do systematic reviews with mixed method studies, and that may lead to some reinterpretation of what the results are. You can also do paradigm or theory-driven approaches to literature reviewing, such as realist reviews, which are becoming increasingly popular now. You can also, at the early stages of studies, do things like overviews, which are sometimes called scoping studies, rapid reviews, or bibliometric analysis, where you count the number of papers that may be published. You may, for example, demonstrate that there's been increasing interest in your topic area over the years. So as I explained in lecture 2, we're going to cover the process of conducting a literature review, recognising key databases, how to create a research strategy, and how to access the actual papers. So I would urge you to look at the next lecture in this series soon. So let's think about synthesizing data from literature reviews. How to identify relevant papers for your review. Because you might find that you have a lot of papers, could be in the thousands, which you can't possibly sit down and read. You will need to check that they're relevant in terms of some criteria that you are going to develop. And once you've selected the papers, you need to extract and summarize the data which is relevant to your review question. So let's think about establishing rigor in your review. You need to have an explicit review question, as I've said already. It must focus on the topic that you're interested in and not be too broad unless you're planning to do a scoping or a rapid review. So you're really wanting then to look at the broad literature rather than the specific literature that you're interested in. You must do a thorough search to make sure that you've identified as many relevant papers as possible, and that will typically mean using a number of different electronic databases, but it may include hand searching or tracing citations, or looking through reference lists. You must, before you start, think about your inclusion and exclusion criteria for selecting papers. So, for example, if you're interested in clinical palliative care, you will probably be excluding animal studies. You may exclude studies that are done in very different healthcare systems, or you may set criteria on language or on things like the date. So it may be that health policies have changed in your country at a particular time, and then you might say that the previous work was not relevant and you will be only looking after the implementation of that new policy directive. So having carefully worked through your inclusion and exclusion criteria, you will be working on extracting data, and you can use a form or more than one form, and often more than one person to help extract the data to make sure it's as rigorous as possible. And I will explain how you do quality assessments of included papers. So that's an overview of how to have rigor. Let's look in more depth at things like a review aim. So this is a published paper in palliative medicine, a systematic review of reasons for gatekeeping in palliative care research. And if you look in the abstract, there's a very specific aim to identify potential gatekeepers and explore their reasons for gatekeeping in palliative care research. And by gatekeeping, we mean people who you have to ask to access people who will take part in your study. So typically clinicians or maybe family members. I've talked about some of the issues with inclusion criteria, but here's a checklist for you to think about when you're planning your review. So the language, and that's often limited by what you can speak and what you can read. So for me, that would typically be English papers, but for you, you may be able to include other languages. Dates. When was the concept or the intervention developed? What is the relevance? Is there something about the country that is important or the geographical region? So maybe you're only interested in research conducted in Europe or in resource-rich countries or resource-poor countries. Are you interested in research conducted in particular settings? So, for example, community palliative care or hospital or hospices. So what's the intervention or the focus of your work that you're interested in? And what's the population? Is it just cancer or is it other conditions? Is it just adults or children or neonates? What is the population group that your study is going to be about? Are you willing to include more than one type of research design? So typically if you did a Cochrane review, you would be wanting to just include randomized control trials. If you're interested in doing a meta-ethnography, you may only be interested in qualitative studies. So it will depend on what you're interested in. So how do we identify the right papers to include? The first screening that you do is of titles and abstracts alone. And then, and only then, after you've got rid of all the duplicates, because usually you'll have a lot of duplicates, or anything that doesn't fulfill your inclusion criteria, you will reduce your sample of papers, selected papers, down further when you get the full text So in the full text, you read through them very carefully and you check, once again, is it relevant? And check against your inclusion and exclusion criteria. So for example, the next thing you do is you want to extract the data from each of the selected papers that is relevant for your review. And there's likely to be a lot of material that is not relevant in each paper. And there are a number of forms that you need to adapt depending on the type of review that you're using. This, for example, is part of a clinical trial form that may be useful for you. So it would be looking at the details of the intervention, how many groups there were, the description of the intervention, the dose if it was a pharmacological trial that you were interested in, the number of doses given and the frequency, how was that drug delivered, the number of patients that were randomized, how many people were lost to follow-up and the reasons, how many people were included in the control group. So it's usually quite a long form, and the forms will vary depending on the design of study that you're interested in including. So this is an example of a mixed methods review data extraction. So what we have here is a list of all the studies which are numbered, and then this is from the gatekeeping review that I mentioned earlier. Then who were the gatekeepers identified? They may be hospice staff, medical committees, physicians, others. The type of article that was published, the country where the data was collected from, the aims of the study, the methods used, the sample, the data collection. So you can adapt your data extraction tool depending on what you're interested in. So some key points to think about and remember. The selection of papers for inclusion in the review is based on a comparison against your inclusion and exclusion criteria. Check on the relevance of the papers to your review question. If they're not relevant, they don't form part of your review. Use a data extraction form and, when necessary, adapt it to your particular topic. So moving on now to the critical appraisal of the literature. So critical appraisal is the process of carefully and systematically assessing the quality of the literature. You do this to judge its trustworthiness and value in the context of your review question. So it may be a perfectly good study, it just doesn't say anything that is relevant to your review question, and therefore you won't be including it. It also enables you to determine the strengths and weaknesses of the papers that you've selected. And for some people, that then gives a weighting, which means that you prioritize or add particular emphasis to papers that are methodologically stronger than others. So we do a critical appraisal to assess the risk of bias, and that is particularly important in randomized controlled trials. We use quality standards. They need to be matched to the review method that you've used. So I gave you a list of some review methods to begin with, and each of them will have a slightly different critical appraisal criteria. And do consider using critical appraisal tools. Once again, there are a number that are available. So in this flow diagram, it helps you think about What type of research do you have in your literature review? Is it quantitative only? Is it mixed methods? Is it qualitative research only? And that will help you make decisions about the type of review to undertake and the type of analysis and critical appraisal that will be possible for you to do. So here are some key points about synthesis and analysis. There are many different approaches to analysis and synthesis, and they need to match what you are aiming to do in your review question. Most are more than a mere description of what you found. So an old-fashioned literature review was a description of a number of papers that you happen to find in your local library. That isn't a systematic review and is not really acceptable now. So you need to justify the approach and the methods that you've used, and it must be congruent, so matching with your review question. So thank you for listening. I hope this has been helpful for you. If you want to read more about how to do a literature review, there is a book called A Postgraduate's Guide to Doing a Literature Review in Health and Social Care that gives examples from palliative care situations. It's published by Oxford University Press and it may be useful for you. And in addition, I've listed some other papers that might be useful or chapters. So this is to acknowledge the funding of the RESPACC study.